Ecuador received international attention after the widespread circulation of images of corpses lying in the streets of the city of Guayaquil. This small country has over 7,500 confirmed cases of COVID-19 up to April 13, 2020, and it also has one of the highest numbers of deaths per capita of all Latin American countries. The stark scenes in Guayaquil have made the country's historical, economic, and social inequalities, now aggravated by the pandemic, all too evident. By mid-March, 15 days after the country's first confirmed case, the Ecuadorian government imposed drastic measures in order to curb the spread of the virus. The measures have tightened ever since, ranging from the closure of borders and non-essential business to a daily curfew throughout the country from 2 p.m. to 5 a.m. The number of victims continues to rise, but the healthcare system is already overloaded. At the beginning of the crisis, nurses and doctors protested because they lacked the appropriate equipment.
No hay mascarilla N95 para el personal que va a entrar a trabajar el día de hoy. Así que chicas, no nos están dando el material para nosotros poder laborar.
Both local and central governments have been incapable of containing the crisis. Due to recent cuts in the public health budget, the country was poorly prepared. In 2019 alone, the budget was reduced by 36%. In addition, the purchase of medical material was temporarily halted on March 28th due to allegations of corruption. The most economically marginalized groups have been hardest hit by the curfew and the mandatory physical distancing measures imposed throughout the country. Approximately half the Ecuadorian population works informally and clearly cannot switch to working at home as they have no guaranteed income. As a result, thousands defy the measures in order to somehow provide their families with a daily income. In Ecuador, there is an urgent need for a robust government-operated social support net, which would help to confront the pandemic. Yet there are no signs that one will be put into place in the short term. The government has approved a cash transfer for the poorest families, but it amounts to only 15% of the minimum salary. Fundraising initiatives, which distribute food packages, are being put into place by local governments, social organizations, and civil society. However, these efforts are insufficient, as living conditions are continuing to deteriorate for the majority of Ecuadorians. The coastal province of Guayas is the most affected, with approximately 70% of all cases. Chaotic conditions still prevail there.
Esta ciudad en el Ecuador registra la mayor cantidad de fallecidos como resultado de la pandemia, incluso superior a algunos países. Y en relación al número de habitantes, es, al menos en América Latina, la ciudad y el país que más víctimas mortales tiene. Una de las cosas traumáticas que hemos vivido acá en Guayaquil, básicamente, es el abandono de cadáveres dentro de casa y también en el espacio público. Dentro del centro de la ciudad incluso, no solamente en áreas marginales, que ese ha sido básicamente el fenómeno mayor. Y eso se debe a que el Estado, el Departamento de Medicina Legal en particular, no llegó con su ambulancia y pasaron esos cuerpos en este clima, 38 grados, durante días, 5 días. Una de las cuestiones un poco más críticas con relación a la pandemia en Guayaquil básicamente ha sido la situación de los hospitales públicos, que si bien es cierto tiene una larga data, pero ahora se ha agudizado y que incluso llega a registrarse casos de extravío de cadáveres, que no son pocos. Y en realidad eso hace que junto al anuncio de las fosas comunes golpee el ánimo de la población, a tal punto que el hecho del respeto a la necroética en relación a los derechos humanos es evidente.
While central and local authorities are blaming each other for the situation in Guayas, the central government has paid virtually no attention to indigenous communities. There is a lack of culturally sensitive epidemiological protocols. Prevention campaigns in indigenous languages are also lacking. Aware of the danger, some indigenous communities in rural areas have taken their fate into their own hands, barricading their villages with tree trunks in an attempt to protect themselves. The high number of people in Ecuador infected by the virus might be connected to its migratory trends. 11% of the Ecuadorian population lives and works abroad, many in the US and Spain. Actually, the country's first confirmed case was an Ecuadorian migrant living in Spain, who was visiting her home country. For immigrants to Ecuador, on the other hand, the COVID-19 crisis is exacerbating their already precarious social conditions. This is specifically true of the country's Venezuelan population.
En lo personal me ha afectado muchísimo a nivel económico porque yo vivo de lo que haga en el día también, yo vivo del día a día. Yo soy independiente como profesional, entonces pues todo se detuvo y no genero pues ningún ingreso. Yo soy voluntaria en una organización que ayuda a mujeres migrantes y venezolanas en especial. Y en esta organización hemos trabajado de tal manera y para recibir donaciones, y la sociedad civil ha respondido muy activamente dándonos donaciones para ayudar a estas personas. Estas son personas que están en una situación bastante crítica porque la mayoría tienen niños, tienen bebés y ellas viven de vender en los semáforos.
Ecuador faces now a very serious problem because of the weakness of its public health system. For example, Ecuador has 5 times less intensive care beds per capita than Germany. In addition, the Ecuadorian national budget, already ailing before the pandemic, is heavily dependent on rapidly falling oil revenues. Nevertheless, Ecuador continues to service its foreign debt in the hope of obtaining new loans. But at what cost? Germany is also taking out loans for its gigantic rescue package. But while German bonds can earn a negative interest of 0.5%, Ecuadorian government bonds have a positive interest rate of 9.5%. This is a small yet bitter illustration of the merciless reality of the financial markets. The current situation in Ecuador is indeed extremely worrisome. State responses to the health and socio-economic impacts of the crisis on the majority of the population are clearly insufficient. And this might be a time of staying at home if you can, but it is definitely a time for social organization and political action. These are key in counteracting the formidable socio-economic challenges faced by the majority of the population.